Good morning, viewer. Welcome to our Optim English. Viewers, a new vaccine approach could offer protection against chikungunya by simply mimicking the virus and activating the immune system. Griffith University scientists say they are closing in on a vaccine designed to stop chikungunya, a viral illness that can severely damage joint tissues and leave people in pain long after the initial fever fades. Interest in prevention has grown as chikungunya continues to spark outbreaks in regions where mosquitoes thrive and can also appear in new places when infected travelers introduce the virus. For the same, Professor Bernard Raim from Griffith Institute for Biomedicines and Glycomics said his team explored an approach that uses engineered Escherichia coli in the short form E. coli as a microscopic factory. Yeah, the goal. The goal was to have the bacteria build biopolymer particles that carry chikungunya antigens on their surface, giving the immune system a realistic target to practice on before a real infection occurs. So the synthetic biopolymer particles adjuvant pre-E2 BP1 closely mimicked the actual virus and induced an immune response, Professor Ram said. Because these particles emitted the outside of the virus without causing illness, so the immune system can respond as if it has detected an invader while avoiding the disease itself. So that means key immune cells can quickly take up the particles, process the antigens, and begin shaping a protective response that is primed for future exposure. Chikungunya. Viewers, chikungunya typically spreads through the bite of an infected mosquito which introduces the virus into bloodstream. From there, the infection can unfold through multiple stages, influencing the immune systems and causing widespread effects in joints and muscles. In some cases, the nervous systems can also be involved. Early illness often includes fever and chills, along with an increased and intense sense of being unwell. People may also develop severe joint and muscle pain, headache, rash, and swollen joints, symptoms that can be debilitating even when the fever is brief. For the same, Professor Ram said that once the infection becomes established, chikungunya shows a preference for joint tissues, muscle fibers, and connective tissue too, a pattern that helps explain why pain and stiffness can be so pronounced. Once this occurs, we start to see direct tissue damage, intense inflammation, and immune mediated attacks resembling autoimmune responses, he said. He continues, even more concerning is that the immune systems continue to attack joint tissues even after the virus has left the body. Up to 60% of patients experience long-lasting joint pain, which may persist for months of years and can resemble rheumatoid arthritis too. Following the success of the study, Professor Raham and his team would progress to the clinical development of the vaccine. I bow down. We are the exclusive report, Optim English, Delhi, Bharat.